Right, welcome back, everybody. So I would like to introduce to you Dr. Tom Levy, who is the world authority on vitamin C. I have it on good authority from Dr. Downing. He cannot be beaten in this respect. He's written 9 books. I'm definitely buying one called Death by Calcium. He's going to do an amazing presentation now on vitamin C, the benefits, how to administer it. So if you give a big warm welcome to Dr. Levy, please.
Okay. Are we okay? Good. Well, it's a great pleasure to be here. I hope I can give you some information that you'll find not only interesting but useful in your personal lives, or if you're a healthcare provider, useful in providing enhanced care to your patients. Let me say at the outset that this is a long presentation and I'm going to flip through some of the slides fairly quickly, but I made it long because I wanted to give a good, complete package of information. In that regard, at the last slide, I have my website and my personal email, and if you want a copy of the presentation, you can just simply send that request to my email, and I'll attach back a copy of the presentation. Throughout the talk, I think most of you know about PubMed, but that's the website you go to. And these days, I discovered that if you just type in the numbers that follow an article, you go straight to the citation. So a lot of the articles that are mentioned just have a number after it. You go to PubMed, you type in the number, and you can go directly to either the abstract or in some cases the full article. Now, I want to start by giving a little bit of a historical perspective to vitamin C and what it's done in the past, what we're doing with it presently, and some of the things that I think we can expect it to do in the future. Dr. Klenner was really in my opinion, singular genius when it came to vitamin C. Much more so than the person who discovered vitamin C, Albert St. Georgi, and got the Nobel Prize for it, and really more so than Linus Pauling, who got a couple Nobel Prizes. Somehow, Dr. Klenner, a few years after vitamin C was discovered and isolated and started to be produced in reasonable quantities, somehow he got in his mind the idea that giving large doses of it would help a wide variety of disease. I wish I knew what his reasoning was at the time. The fact of the matter was, he started using multi-gram doses, 15, 30, 50, even 100 grams of vitamin C at a time, intravenously and sometimes orally. And he clearly documented the ability of vitamin C to reliably cure many different acute infectious diseases, and perhaps less well known, but as significant or even more significant, is the fact that vitamin C is the ultimate antitoxin. It will neutralize and has neutralized all toxins against which it's been tested. And this threw me for a loop for a long time, because I said, how can one simple molecule neutralize the toxic effects of such a wide variety of different chemical structures? And we'll go into that a little bit. And this is one of Dr. Klenner's big review articles that give you a lot of information on what he did. Okay. What has vitamin C already been proven to do? Kill and inactivate all viruses in vitro against which has been tested. This has been the case with the polio virus. This has been the case with herpes viruses. Case with Vestidia viruses. I throw in tobacco mosaic just to show you it's a wide variety. Interestingly, bacteriophage viruses, that's viruses that can infect other viruses. It can go straight into bacteria, okay? As well, enteroviruses, influenza, and even the widely feared rabies virus, completely inactivated in vitro. The problem with the rabies virus is, to my knowledge, nobody's ever actually used vitamin C in a human case of rabies, so I can't cite you that evidence. Okay. Now that was all in the test tube. In vitro. What has vitamin C been documented to do in the body? Acute viral syndromes. Now, Dr. Klenner probably had a few screws loose to do some of the things that he did, although he was wildly successful. In the 1948 polio epidemic in the southeastern part of the United States, Dr. Klenner was in North Carolina. They were having cases of polio right and left, and he shared hospital privileges, and so he saw patients that came into the emergency room when it was his turn. Well, in 1948, he had the opportunity to treat 60 cases of acute polio. And of note, at least 50% of those cases of acute polio were documented by spinal tap. So it wasn't just some sort of nonspecific polio-like syndrome. It was polio. Then, the bold and brazen Dr. Klenner, with little babies and small children who weren't really good candidates for IVs, he gave a lot of the vitamin C intramuscular. And in 3 days, he completely cured 57 out of 60 cases of polio. The other 3 cases just needed 2 more days of vitamin C, and they had a 100% response rate. If you think about this more than just a fleeting second, I mean, you should have a box of Kleenex alongside you to see and think about all the suffering that's taken place with polio and continues to take place in polio, even in countries like Africa. And the long-term damage to those that survive it, paralysis, impaired motor function. It's a crime against humanity. A crime against humanity that this still is not routinely used. In one particular case, again showing how if you go high enough and long enough, you can get otherworldly effects. He had one little girl that came in, was brought in, and she had already had polio for 2 weeks. And her lower extremities were flaccid, just like dead meat. Using the same protocol, he completely cured that, brought her back to a normal state, but it just took several weeks rather than a few days. Okay. He also showed, and other investigators showed, that you could get some pretty phenomenal results with oral vitamin C. You just had to take a lot of it. So certainly don't leave here today thinking, I don't have the opportunity or ability to utilize vitamin C because I can't get IV vitamin C, this sort of thing. A lot of stuff has been cured with a large amount of oral vitamin C as well. One investigator, Greer, treated a lot of polio as well, and others using smaller doses of vitamin C showed accelerated resolution of the polio syndrome. Basically, it's just a dosage situation, how long you use it, how much you use it, how large is the viral load in your body. It's not magic. You need a certain amount of vitamin C for a certain amount of virus. You fall short, you don't resolve the situation. You exceed it for a long enough period of time, you resolve it. Acute hepatitis, actually very easily remediable. I emphasize acute. Don't confuse that with chronic hepatitis. Patients with chronic hepatitis, that's a whole different bag of worms, okay? It responds to vitamin C therapy, but nowhere nearly as dramatic as an acute viral syndrome or an acute viral hepatitis. And Cathcart, who treated a lot of viral hepatitis with IVC and oral vitamin C, none of his patients, and he probably treated hundreds of them, ever developed chronic hepatitis after being initially approached with the vitamin C. There's Klenner's little formula, how he would dose his vitamin C. Some of the more dramatic things that Dr. Klenner did was he had occasion and reported on a substantial number of individuals who presented with viral encephalitis and were in coma when they presented to him. Even in this advanced state, he was able to take a number of them and bring them back to consciousness within a few hours and have them cured of their viral encephalitis in several days. Now, if you haven't seen this, go see it. You can get it on YouTube too if you type in a few appropriate phrases, but this is my website with that part of it video. Well, let me see a show of hands. How many of you have seen the 60 Minutes New Zealand video of the New Zealand farmer who was getting ready to have his life support terminated? Okay, probably 20 or 30%. Well, to the rest of you, make sure you have a box of Kleenex with you. It's extraordinarily well done, and it should amaze you and sadden you and enrage you all at the same time. Now, other acute viral syndromes that Klenner worked with resolve very quickly: measles, mumps, acute herpes infections, chickenpox, and in animals, it cured rabies very readily as well. Like I said, there weren't any human cases of rabies where, to my knowledge, anybody had the opportunity to try vitamin C. Okay. Exotic, somewhat less common, diphtheria, tetanus, staph and strep are exquisitely sensitive to vitamin C. Pseudomonas, a very common bacterial infection in the chronic hospitalized patient that's highly refractory to most antibiotics. So the way to put it together is to realize that vitamin C is an absolute viricide, at least in all the viruses against which it's been tested. I'll float a few thoughts about Ebola toward the end of the presentation for your consideration. So it's an absolute viricide. It always kills or neutralizes or otherwise destroys a virus when you get the vitamin C in direct apposition to the virus. Now, like with chronic hepatitis, with Lyme disease, which is, I know that's not a virus, AIDS, these things you can get very positive responses, and sometimes you can get cures, but they're much more difficult to achieve because the virus or the pathogen gets into areas where the vitamin C does not have ready access. Okay? So, it's an absolute viricide. It's often bactericidal, meaning killing bacteria. It's almost always bacteriostatic, meaning stopping the bacteria from growing, and then the immune system can kick in and do its job. And very important to remember, because this is good for any patient with any condition under any circumstance. Vitamin C always strongly supports an optimally competent immune system. In Curing the Incurable, the book, I found at least 20 different separate mechanisms where in the literature it's been documented how vitamin C is the single substance that gives strong support. I mean, just a few: vitamin C promotes the production of interferon, promotes the production of antibodies, and even if you hate vaccines, and you should, if some child is going to get a vaccine, come hell or high water, make sure they got a lot of vitamin C before, the day of, and for several days after. And you can probably make the vaccine a non-toxic event effectively. You neutralize the toxicity, and at the same time, you augment whatever antibody response you might be destined to get with the vaccine otherwise. Documented efficacy in non-viral infections: malaria, very positive responses to very low doses. And you can see how recent that article was written, 1938, so it really turned on a lot of investigators to look into that today. That's sarcasm. Okay. Leprosy, typhoid fever, brucellosis, trichinosis, dysentery, trypanosomes, that's syphilis, and other trypanosomes, Chagas diseases. It doesn't matter what the infection is, vitamin C is always going to help resolve it, if nothing more than because it's the single critical, most important factor in maintaining and supporting a strong immune system. The number one frontline cells in your immune system are the monocytes. When you get inflammation, the first cells from the immune system that appear are the monocytes. Well, I got two pieces of information to explain why that happens. Number one, wherever you have inflammation, by definition, you have an acute consumption of vitamin C, because inflammation is oxidation. Oxidation consumes antioxidants. So where you have oxidation occurring, you have an increased and rapid consumption of vitamin C. Now, the monocyte has 80,000%, 80-fold more vitamin C concentrated inside it than the plasma. It's just a literal, ripe time bomb filled with vitamin C. So now, when you have inflammation and you acutely deplete your vitamin C, and the first cells that come to that site of inflammation just happen to be the cells in the body that have the highest concentration of vitamin C. So I can't tell you for sure that it's a vitamin C delivery system, but it sure fits the model. Now, that stuff was pretty impressive, I would say. Always impressed me, including the polio in particular. But vitamin C is the ultimate non-specific antitoxin, aka poison antidote, both in the test tube and in the body. Toxic elements that it neutralizes the effects of: mercury, lead, chromium, arsenic, cadmium, nickel, vanadium, aluminum, fluorine. Venoms. You know, we have such fixed mindsets in medicine, but there's so much damage that's done by antitoxins and anti-snake serum in an attempt to save a patient. The one particular case report that Klenner worked with, I mean, he had to really neutralize the toxicity of the venom and the toxicity of the antitoxin in order to get the patient recovered. Another one, alcohol. I suppose this is good, but whenever I overindulge, I don't get drunk anymore. So kind of, what's the point? Well, you're used to it, you like the taste, you're celebrating with family and friends or whatever, but alcohol is a toxin, and if you're antioxidant matrix spearheaded by vitamin C is high enough, you're not going to get looped. Barbiturates, same thing. Toxic mushrooms. The Amanita phalloides mushroom has one of those toxic substances on the planet and kills people really quickly when they eat the wrong mushroom. This fellow Lang, a Frenchman, I believe, and nothing against the common sense of the French, but he saw what vitamin C, along with other antioxidants, did in neutralizing the toxicity of Amanita phalloides, and so guess what? He would put on presentations, and in front of the audience, he would eat the triple fatal dose of mushrooms in front of them, and then proceed to save himself with his antioxidant cocktail. I haven't reached that level of security yet. Pesticides, very, very potent. Strychnine, we always hear jokes about the toxicity of strychnine. Well, vitamin C nails it all, both in the test tube and in the body. Now, definite benefits, I said it helps the immune system. Some of these syndromes can on rare occasion be cured by high-dose persistent vitamin C. And in fact, I'll just sort of tantalize you a little bit with this. I've had feedback. You might say I treat a lot of people at arm's length. Physicians and healthcare providers send me emails. I got this. What do? I say, try this, but make sure you tell me what happens. So by that mechanism, after giving a presentation in North Carolina, a nurse practitioner there wrote me an email and said, I think you'd be interested in this case report. I said, okay. There was a middle-aged lady who had chronic Lyme disease, had it for 10 years. Positive blood work, everything. And I'm still not sure if it was because this nurse listened to me talk about high-dose vitamin C, but anyway, this lady got the idea in her head that she was going to cure her Lyme disease with IV vitamin C. And so even though she wasn't particularly well off, she managed to convince the people at this facility to give her a daily infusion of 100 grams of vitamin C. And she did this day after day after day. After 2 weeks, she felt completely horrible, didn't feel better at all, was spending a lot of money, but she wanted to continue. So another day, another day, another day. On day 21, after showing no improvement at all, the nurse practitioner reported to me, she came in, it was like a light switch. She was fine. And then she continued it for another week just to make sure there wasn't any relapse. And a month later, all her Lyme testing was normal. And she remains completely resolved today. But the point is there's mechanisms going on that we don't understand. I mean, how can you show no improvement at all and then you show all the improvement in one day? Obviously, you're doing something at the cellular level, but it just takes that long to manifest. And since then, I've had another doctor report to me almost carbon copy experience as this particular lady on about 15 other Lyme patients. All right. Something not too well known, but radiation toxicity is really nothing more than a non-tangible form of electron depletion, of oxidation. And when you get enough vitamin C present after the fact, or even during the fact of radiation exposure, you can neutralize most of the time all of the negative effects. And a colleague of mine in Japan, after the horrible nuclear plant event, put together a little protocol with not exceptionally large amounts of vitamin C and some oral liposome encapsulated vitamin C and alpha lipoic acid, selenium, and a multivitamin. Just doing that in the most exposed workers that were going directly into the plants, he was able to show a decline in basically broken DNA and the other types of things that occur with radiation that ultimately, if they don't kill you immediately, they kill you later with cancer. Okay. So, some practical considerations when you're dealing with vitamin C. Remember that it enhances the immune function. It has its own direct anti-pathogen properties. And so many infections also have toxicity. And that's what further makes vitamin C such an ideal agent, is it has mechanisms for killing a pathogen, and it also has mechanisms for mopping up and neutralizing the pro-oxidant debris that results from lysing viruses, from lysing pathogens, sometimes from lysing cancer cells. Pathogens and cancer cells accumulate iron. They thrive on iron. Well, elemental iron, Fe2+, Fe3+, is highly toxic. And when you have a pathogen or a cancer cell rupture and release all that, you need to be prepared to support your patient or they can get worse. And I'm going to mention this toward the end of the lecture. This is one reason why we got to be careful with Ebola virus, because these patients don't have an immune system, they don't have a nutrient status, and if you kill all their pathogens all at once, they could very well die from the toxicity of the kill-off if you don't build up their nutrition first. All infections consume vitamin C, okay? And it's still never been done. I mean, we know vitamin C levels drop as you get sicker, but when you're trying to get, which is still not easy anywhere in the world, United States or the United Kingdom, when you know vitamin C could help your loved one, try one thing first. Shouldn't be an outlandish request. Request that the physician draw a plasma vitamin C. And almost without exception, that's going to be depressed to low. And then you request the physician to treat this established deficiency that's now present on the laboratory testing. Okay, you do a test, the vitamin C is low, shouldn't be any problem giving vitamin C. And even if you give a suboptimal dose, you're going to help. All right. Oxidative stress. Okay, when free radicals, toxins, are pro-oxidant, and they're present in the human body in an amount in excess of the body's ability to neutralize it, then you have a state of increased oxidative stress. Okay. This is how vitamin C neutralizes all toxins regardless of the structure of the toxin, which at first is highly counterintuitive until you realize that all toxins poison in the same way. You have different syndromes with different toxins because their chemical structure gets them in different tissues and different concentrations, and they affect different areas. But at the molecular level, they all do the same thing. All infections and all toxins cause cell damage and produce symptoms by increasing oxidative stress, period. But this manifests itself as different disease syndromes when that increased oxidative stress is in one area, not another, has chemical properties that cause them to affect other molecules of like fat soluble, water soluble, whatever the predispositions are of the patient, and very importantly, the chronicity, how long has it been present, and degree, how much of it is present. You push all those variables together, along with a different chemical structure, and you can create all the different syndromes that a toxin or poison exposure can result in. So, very important concepts to leave this little talk with. The nutrient-toxin relationship. Okay, the defining property of a nutrient is its ability to metabolize into and eventually break down into a substance that has the ability to donate electrons. That's all a good nutrient is. Okay? And that's called an antioxidant. Antioxidant equal the final common effect of a nutrient. Now, the defining property of a toxin, directly or indirectly. Okay, sometimes it's the toxin itself that takes electrons away. Sometimes it inactivates molecules that would have donated electrons. So, the defining property of a toxin is its ability to deplete electrons. A pro-oxidant is a toxin is a pro-oxidant. So, all toxins share the ability to take or cause to take electrons from tissue. So I put together what I call, at least my basic laws of redox biology. Electrons are the fuel of life. Okay? Literally. Number two, bearing in mind that they're the fuel of life, all increase oxidative stress, which is the final common denominator in all disease inside the cell spaces, cause electron depletion and inhibit optimal electron flow. This is why some of these pulsed electromagnetic therapies are getting such good results, is because when you put a magnetic field into the body with motion at a 90-degree angle, you produce a low-grade current, electron flow. Number three, all toxic effects, so all symptoms to all diseases, are caused by increased oxidative stress. And then putting it in a different capsule, increased oxidative stress, depending on where it is and its intensity, is the disease. I'll run through these real quick, but this just tells you why you can have such a wide variety of clinical expressions when toxins just do one thing, which is take electrons away. Different toxins have different solubility characteristics. They have a different molecular size, permeability. They may be ionic or neutral. Over a long period of time, they can actually have an increased physical mass in tissue blocking function. And for those that you might be getting into this, when vitamin C or an antioxidant donates its electron, it's oxidized. So you might say, how is that oxidized antioxidant, which is now missing electrons, how is that different from a toxin, which is also missing electrons and looking to take it? Well, vitamin C and other antioxidants are designed to go back and forth, back and forth, back and forth. The electron potentials are very close, so they give up electrons as easy as they take them. A toxin, by characteristic, by definition, by nature, takes and keeps. So once it takes electrons away, it's reached a more biochemically stable structure, and it's not going to give them up. Okay. Now, getting more into the current time, prominent promoters of chronic degenerative diseases. You have infections, endotoxins, exotoxins. Biggie here, dental. I'll just tantalize you a little bit. Dr. Kulatz and I are coming out with our new book in a month called The Toxic Tooth, How Root Canals Make You Sick. And I'll just tell you, the nature of the root canal procedure makes it the most toxic entity on the planet. And it's in your mouth, where you chew, and where you squeeze these toxins out. and to the lymphatic supply and the blood from your mouth. And I'll tell you, as they say, shock and awe. Well, the root canal treated tooth is the number one cause of head, neck, and chest and breast cancer. And because of the fact that the first artery that the pathogens and toxins expressed from these root canals reaches is your coronary artery, it's also the single greatest cause of heart attack. In the dental literature of all places, they very recently published a study that said if you have a root canal in your head, you have a greater chance of heart attack. I don't think many endodontists are telling their patients that before they do these procedures. So, other promoters of chronic degenerative disease, other toxin exposures, toxic iron status. For goodness sakes, never, 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 never take an iron supplement unless you have a documented iron deficiency anemia. Otherwise, you're just increasing the metabolic oxidative stress inside all of your cells and making any underlying diseases process worse. This also applies to copper. Never, never, never supplement copper. There's not a need for it. There's no such thing as a deficiency of copper in anybody that I've ever seen or read about. And this is covered in the newest book, Death by Calcium. Let's just say that title is not an overstatement. Probably the most significant article, although there's many articles that are cited, in 2013, a 19-year study on 60,000 women clearly showed the ones that drank the most milk and took the most calcium supplements were 2.5 times more likely to die than the ones that had the least. So it's an involved topic. There's a lot of information there, but just realize that once again, as has been pointed out by other people here expressing themselves, it's just kind of incredible how many times what you're told by the government, by your doctor, by anything helping to control your life is the 180-degree opposite of the truth. Okay? Biggie here, dietary toxin exposures, okay? We talk about vegan diets, non-vegan diets, organic food, inorganic food? No, non-organic food. And I will submit to you that the most important part of your nutrition comes in how well you digest your food. If you're pooping less than 1 time a day, you've got some serious toxicity issues. If you go to the bathroom and nobody else can go to the bathroom after you're there for a half an hour, you've got some serious toxicity issues. Okay? If food doesn't get out of your system in 18 hours or less, it stops digesting and starts to rot and putrefy. And the rotting and putrefaction causes a proliferation of the same type of anaerobic pathogens that are present in the horrible root canal teeth I just told you about. So you sort of have an acquired root canal of the chronically constipated gut. Bottom line is, I can't give a big presentation on nutrition right now, but I will tell you that obviously you want to eat pure food, organic food, toxin-free food, non-GMO, but I'm going to tell you the worst food combinations you could put together that you digest perfectly is going to cause you less toxicity than perfect food digested poorly. So do both. Select good foods and digest them correctly. And it has to do with food combining. Dr. Pavlov, the Russian physiologist that won the Nobel Prize in the early part of last century, did physiology experiments on dogs, and he took, grotesquely enough, what's called open stomach preps on dogs, and he put pure starch in the stomach. That took 60 to 90 minutes to evacuate. Then he put in ground up meat chips. That took 3 hours as a single meal to digest and poop. Then, I don't know what he was thinking, but he put the starch and the meat together. You know how long it sat in the stomach before it got out? 9 hours. That's the important food combining. Unfortunately, UK, United States, we all have our dietary habits based on we want to eat what we want, when the heck we want to eat it, and with whatever we want to eat it with. That's fine. Go ahead and do that. But realize you're making it impossible to digest correctly, and you're vastly increasing the enormous amount of chronic toxicity that a constipated, putrefying gut has to offer you. Hormone imbalances, those are biggies too. So, really oversimplifying something that deserves more time, when people have cancer and heart disease, and they are undergoing whatever the protocol is they're undergoing, and there's a lot of good protocols. I'm not really out to pick on one or another, this, that, or the other. But the root of your problems, no pun intended, has not been addressed, no matter how good your response might be early on. You know how cancer patients get better and the cancer goes away and a year later it comes back? Or you get a new cancer. That's not bad luck. That's unneutralized toxins. A German researcher that treated chronic metastatic cancer patients in the 50s found that 97% of his patients had root canals or infected teeth. Okay. So, dental toxicity and hormone imbalances. You know, you get low on thyroid, you get low on testosterone, low on estrogen, you increase your chance of death by all causes. So these things need to be addressed intelligently, and they shouldn't be over-addressed. On hormonal imbalances, you want to make a deficiency in the low normal range. You don't want to push it high normal. Okay. Kind of already said that one. So, vitamin C. What do you want to do when you give it? You want to get as much of it inside the cells as possible in its reduced, non-oxidized form. Sounds simple. The big factors in giving vitamin C: dose. You don't use enough, it's not going to do what you want. Route or type: regular oral, liposome encapsulated, intravenous, and intramuscular. And all of these can have different effects and have applications in one scenario that wouldn't be good in another scenario. Rate: how often do you give it? Well, how well did the patient respond to the first dose? Did they get a lot better right away? Well, then you don't have to jump on the second dose again. If they're still getting worse, your solution is more, given more quickly, given more frequently. Type: well, with my book, Death by Calcium, I'm telling you, avoid calcium ascorbate. Avoid all sources of calcium, except as is present in a balanced diet with you having a normal vitamin D level. Your body will take the amount of calcium it needs. But nobody in here has a deficiency of calcium. Maybe in your bones, but in your body you have an excess. Adjunct therapies. A little point about antibiotics. If you have a severe infection and the vitamin C isn't taking care of it, don't feel reticent to take an appropriately selected antibiotic along with it if you have a organism that's responsive to it, because vitamin C and the antibiotic can be very synergistic. But that's only if the vitamin C is not doing the job all by itself. But don't turn all antibiotics into boogeymen. They do have their indications where, in conjunction with vitamin C, they could be quite life-saving. Okay, I just talked about dose, route and form. This is what Dr. Klenner described when he was giving intramuscular. You can read that at your leisure. Now, What about this oral liposome encapsulated vitamin C? Well, I became involved with this. I became involved with the company that made it 10 years ago because it continued to do things that I didn't think were possible. And after seeing it do it several times, I said, after several months had gone by, I said, well, Dr. Thomas Levy, I think you're an idiot if you don't figure out what a liposome is and why it's doing what it's doing. In my personal experience, and you might have seen this circulate on the internet because there's no other source of it, I have said, and I stand by this, that 5 grams of properly encapsulated vitamin C in liposomes can have an equal to greater clinical impact on an acute viral syndrome than 50 grams of vitamin C given intravenously. And I've seen that repeatedly. So don't feel like all is lost if you have a situation and you can't have access to IV vitamin C. When you're really sick, you want as many different forms as possible. Don't get me wrong. But don't feel like all is lost if you can't get the IV. So liposomes cause a rapid and enhanced absorption. There's no stomach upset or associated diarrhea, and that's what got me to use it the first time was I was feeling horrible. I'd taken as much regular vitamin C as I could, and I was just having loose bowels all over the place, and I couldn't take any more. My clinic was closed. I couldn't give myself an IV. And then I saw this damn box of liposome encapsulated that I'd thrown on the floor several months earlier and said, well, maybe I should try that. Intracellular bioavailability. This is the biggie. People, doctors, other scientists, they keep on going back to blood level. Say, well, what kind of blood level does the liposomes cause? Well, you get such a higher blood level with IV, or apples and oranges. What liposome vitamin C does is by its unique structure, it gets it inside the cell. So forget about seeing what your blood level is. What it's doing when the blood level is declining, if you do measure it, it's not because it's being excreted out the kidneys, it's because it's going inside the cell. And it's going inside the cell without consuming energy. That's a biggie. When you take it intravenously, you either take in oxidized vitamin C passively, DHAA, or the reduced vitamin C, which is what you want inside the cell. You need an active energy-consuming transport mechanism to get it inside. So it's robbing Peter to pay Paul. The liposome gets it in without the consumption of energy. Okay. And the lipids that come with it have good value too. Rate. Rate is very important when someone's dying. Other than that, you can use rate to manipulate things depending on you're dealing with a chronic situation like cancer or an infection. But Dr. Klenner, yes, let me read this to you. In Dr. Klenner's own words, he was treating a cyanotic, that's blue from no oxygen, acutely poisoned patient who felt he was dying. And then in Klenner's words, his words, 12 grams of vitamin C was quickly pulled into a 50 cc syringe and with a 20 gauge needle was given intravenously as fast as the plunger could be pushed. Even before the injection was completed, the patient exclaimed, "Thank God." So when you put vitamin C in direct contact with the toxin, the vitamin C wins. Important thing about rapid infusions. Vitamin C is very close in structure to glucose. What happens when you give the body a large amount of glucose? You secrete insulin and metabolize the glucose. What happens when you give the body a very large amount of vitamin C very rapidly? The pancreas sees glucose and secretes a large amount of insulin. So you can make people symptomatically hypoglycemic by giving vitamin C rapidly. Just something to keep in mind. That can be utilized in a very therapeutic fashion, but that's getting beyond what we have time to discuss here. I don't know how many of you have heard of insulin potentiation therapy. They give small doses of insulin, give a little bit of chemotherapy, The insulin opens up the pores on the cell, and you get an increased access. So when you give vitamin C rapidly IV push, you get what I call an endogenous, from your own body, induced form of insulin potentiation therapy. Except the insulin comes from your pancreas rather than from the syringe. And you have a protected hypoglycemia because having large amounts of vitamin C circulating in your body and in your brain makes you less susceptible to any deleterious effects of the hypoglycemia. Okay. Frequency, talked about that. Duration. I learned this the hard way several times, but Klenner repeated it many times. When you're dealing with an infectious syndrome, don't stop treatment as soon as the patient feels fine. Continue high-dose vitamin C at the same level that it took to resolve the syndrome for at least 1 and preferably 2 days longer, or you will very commonly get a relapse. Let's see if I can tell this story without shedding a tear. I had a little baby min pin puppy, maybe 1/3 of a pound. We got him, my wife and I, back from the vet, and he was practically dead on arrival. He was just flaccid, but he was still breathing. I had some of the liposome encapsulated vitamin C, so I said, what the heck. So I pulled up a packet of the Lipo C with a little bit of milk. Now remember, that's 1 gram of vitamin C, and this is like inside something that's 1/3 of a pound, so that's like 200, 300 grams for you or I. And he still had a swallowing reflex, so I gave it, swallowed it all, and then I said, well, I can't do anything else. And I went back to working on the computer. About an hour later, he gets up, walks across the room, takes a pee, takes a poo, and then what does I do? Nothing. I didn't give another dose. I didn't follow it up, and an hour later, he was flaccid and dead. But the point is, you gotta keep going. You gotta keep going. Well, I almost got through that one. Type. This is addressed on my website. There's a bunch of articles you could read at your convenience. They got some malicious ignorance circulating now that says ascorbic acid is not vitamin C, and even if it were vitamin C, it's not good for you unless you take it in a vitamin C complex. All this is marketing crap, marketing hype. I mean, they have formulations that work that are good, but you don't need to pay that much, and all the profound literature that we have was using just ascorbic acid and just sodium ascorbate. And Dr. Albert St. Georgi, that discovered vitamin C, said ascorbic acid is vitamin C. So if you see this ridiculous stuff circulating on the internet, know that it's ridiculous. Vitamin C is the ascorbate anion. You can take it with hydrogen, ascorbic acid, with sodium, with calcium, with magnesium, potassium, manganese, zinc, anything that will bind to it, okay? All of those can give you vitamin C effect because the ascorbate ion is there. But you have to be careful with these other things because these are things, especially like potassium, that you don't want to take in the massive amount that you need to take the vitamin C. So that's why you pretty much stick with hydrogen or sodium. If you've got the money, the more magnesium the merrier. You can't overdo on that. Adjunct therapies. One thing I'd mentioned about antibiotics with vitamin C, it's an interesting point, and I just stumbled across it. It was incredible to me because I didn't know it. But I first realized that pathogens proliferate when you supply the body with large amounts of iron. That's what gets it going. They're little iron-eating machines. A very large percentage of the most successful antibiotics we use are iron chelators. They just bind up the iron and they effectively start starving the pathogen. Okay. My multi-C protocol. Now, I want to first start out and say that you can get the cheapest form of regular vitamin C available, usually a vitamin C powder, ascorbic acid, sodium ascorbate. And if you have an acute infection or even a chronic medical condition and you're persistent with your dosing, you're going to almost always resolve the infection and almost always get symptom relief to some degree of whatever disease you're dealing with. That said, if you have an infection, if you have a chronic condition and you're not getting the effect that you want and you feel that you've pushed the dose as high as you want to of one particular sort, remember that the real way to do the optimal amount that you can with vitamin C, and you can do a heck of a lot, is with the multi-C protocol. The oral liposome encapsulated gets it inside the cell. The sodium ascorbate or ascorbic acid powder, taken as multiple gram doses several times a day to the point of bowel tolerance. Most people it's going to be 12, 15 grams. Other people that are sicker, it's going to be 30, 40, 50 grams. But the point being is, what did I tell you was a huge source of toxicity in so many people? The gut. So you have a mechanism here. Quite honestly, I did it daily for years, but I'm not recommending that. But if you did it once a week, once every 2 weeks, when you're off work and you have your own comfortable facilities that you can go running to, don't really want to do that at work too much, but it cleans out the gut, okay? Toxins that are being formed in situ are neutralized, and what it doesn't neutralize, it flushes out. So you really get a good reset on this. Oops. I don't know what I bumped. Okay. Gotcha. Wow. Okay, there we go. And they even make fat-soluble forms of vitamin C, ascorbyl palmitate, and then you have the IV. So you get it inside the cell, you get gut neutralization of toxins, you get fat access, and at the same time, if you have access to intermittent IV, you get a flooding with super high concentrations of vitamin C in the extracellular spaces. Okay? That's something you can look at a later point if you're figuring out dose. You give, the rate depends on what you're treating, infection, toxin. Mop up vitamin C. A lot of people will get sick. I was talking about this earlier. If you kill a lot of microorganisms all at once, if you kill a lot of cancer cells all at once, and the patient's probably not going to come back to you if they feel really crappy at the end of the office visit. Believe it or not, when you give a much smaller dose of vitamin C at a much slower rate, after you've induced this Herxheimer, that's the best treatment for it. So the same thing, vitamin C, that in high doses cause the clinical deterioration, is going to resolve that clinical deterioration because the deterioration is due to the pro-oxidant effect of toxins. You just follow it up with a dose much lower, much slower, that's not going to kill a lot more cancer cells or pathogens, and then you can tune the patient up before they go. Much happier patient. Well, I already harped a little bit on iron calcium. And I talked about the fact that you really can't have too low a level of iron if your blood count is normal. Okay? These are the mechanisms by which vitamin C kills pathogens and kills cancer cells, the Fenton reaction. And okay. And for those that are a little more into research, you can see that viruses have many areas of access where excess iron is present, and when vitamin C comes in contact with the iron, it donates an electron to the iron. The iron then that's reduced donates its electron to peroxide that's nearby, and the peroxide breaks down into something called hydroxyl radical, which is the most toxic reactive substance on the planet, causing severe oxidative stress or death. Okay, what about Ebola? All right? Number one, vitamin C has never cured Ebola. Number two, vitamin C has never been used to treat Ebola. Okay? But am I going to tell you that it will cure Ebola? No. Am I going to tell you I'd bet my entire bank account that it would? Yes. Okay? The important thing, though, and this is very important, and we have different, I know of several different groups that are interested in treating Ebola, and they got a lot of different things in their arsenal, not just vitamin C, that are effective in killing a virus. We've talked about some of them here today. The point is remember the Herxheimer reaction, okay? You still don't hear about Ebola or other hemorrhagic viruses like we see in Africa and South America killing people in the United States. Well, why not? We got mosquitoes. Okay? We don't because the average, I know I'm in the UK, okay, the average United States citizen and the kid that eats nothing but chicken McNuggets every day has a better nutritional status than the African. Okay? And so we kill cancer cells, we kill viruses, patients feel a little bit bad, and then they get better. Now, if you do that inside one of these African natives that has 4 vitamin C molecules knocking around against each other, you can cause more harm than good. So all of these protocols, especially if you're quite confident, are going to be successful in killing or neutralizing or lysing the virus, need to be done initially if time permits. I mean, if they're literally on death's doorstep, you do what you can. But there's lots of early cases of Ebola. Build up the nutrition first. Okay. And I had mentioned on an earlier slide about infections in general. Ebola and the other acute hemorrhagic fever viruses share something in common, is that they're hemorrhagic because they consume just about every molecule of vitamin C in your body. And if they'll ever measure that, they'll see they can't find any vitamin C in the urine or the blood of these individuals. And when they finally hemorrhage, it's because the connective tissue has degenerated and there's no vitamin C left to reconstruct new tissue. And when blood vessels lose connective tissue structure, especially at the capillary and venous level, they just break apart and you die of hemorrhage. Okay. Very important with all infections, no matter what you're using, even if you're going to ignore vitamin C, which I wouldn't advise doing, vitamin D. Vitamin D is extremely critical in managing your infections and your propensity toward infections. Okay. Particularly with regard to Ebola, something that they're not doing that they should be, and mind you, they don't talk about this much, but there's a very large number and a very high percentage of healthcare workers in the affected areas of Africa that have also died of Ebola. So I submit that whatever you do or what a group decides to do to approach and cure or resolve Ebola, you do completely the same thing to the healthcare giver on the same day. The whole shoot and caboodle, okay? Give it all to the patient, give it all to the healthcare provider. And something that Mark Twain once wrote, be careful in reading health books. You may die of a misprint. However, in this day and age of what I call massive misinformation, I would be so bold as to correct Mark Twain's quote just a little bit and say, be careful in reading health books. You may die from something printed as intended. So just remember that ignorance as well as misinformation is often deadly. That's my website. That's my personal email. Even if you have a vitamin C related question, I can answer that. I can't do consultative type things. So, I mean, if you say, I got this, what should I do for it? I'll tell you, find a doc you can work with. And if that doc wants to email me questions regarding your type of situation, I can do that. Okay? But if you want a copy of the presentation, just send an email there, and by the middle of next week, I'll get you back the lecture. Thank you.
That was brilliant.